Bismillahirrahmanirrahim. Assalamu alaikum everyone. My name is Amna from Department of Biotechnology. Today I'm here to represent the topic of chemotherapy. So here are its contents: introduction, principles, working, advantages, side effects, conclusion, and reference. So let's get started with the definition of chemotherapy. Chemotherapy is the drug treatment for diseases caused by pathologic microorganisms, parasites, and tumor cells. Actually, chemotherapy is composed of two words, chemo and therapy. Chemo means chemical and therapy means treatment. So chemotherapy means treatment with use of chemicals or drugs. Chemicals or drugs used in chemotherapy may be synthetic or natural. Synthetic are those who made in labs, and natural chemicals are those who naturally present in atmosphere or environment. Chemical substances used to kill the microorganisms and cancer cells. The intent of chemotherapy is to destroy as many tumor cells as possible with minimal effect on healthy cells. And next, working of chemotherapy. A chemotherapy circulates towards the body in bloodstream in form of blood. So it can treat cancer cells almost anywhere in the body. This is known as systemic treatment. Chemotherapy kills cells that are in process of splitting into two new cells. Actually, in chemotherapy, in this technique, cancer cells are when cancer cells are about to split into two new cells, they kill by the method of chemotherapy. So in cancer, the cells keep on dividing until there's a mass of cells. This mass of cells becomes a lump called a tumor. Tumor cells are also called cancer cells. Because cancer cells divide much more often than most normal cells, chemotherapy is much more likely to kill them. Next. So here's a diagram. We can see that here are some cancer cells, and when we inject chemotherapy drug on them, chemotherapy drugs kill these cancer cells by damaging the DNA inside the nucleus. The effect on dividing cells. Chemotherapy damages cells as they divide. In the center of each living cell is a dark globe called the nucleus. The nucleus is its control center of cell. It contains chromosomes, which are made up of genes. These genes have to be copied exactly each time a cell divides into two to make new cells. Chemotherapy damages the genes inside the nucleus of cells, and some drugs damage cells at point of splitting. Some damage the cells while they are making copies of all their genes before they split. Chemotherapy is much less likely to damage cells that are at rest, such as most normal cells. Actually, there are anti-cancer drugs that are used to control or slow the cancer cells and prevent cancer from spreading. For example, there's a drug, methotrexate, that is used for control of cancer. Next, method of chemotherapy given. And here are some methods by which we can kill the cancer cells. Injection. So it is the most common method. The drugs are delivered with a short directly into muscle in your hip, thigh, or arm, or in fatty part of your arm, leg, or stomach just beneath the skin. Intra-arterial. The drugs go directly into the artery. So artery is a blood vessel through which it carry oxygenated blood from heart to your different body parts. That is feeding the cancer through a needle or soft, thin tube, which is called catheter. Intraperitoneal. The drugs are delivered to peritoneal cavity, which contains organs such as your liver, intestine, stomach, and ovaries. It is done during surgery or through a tube with a special port that is put in you by your doctor. So next, advantages of chemotherapy. Cure cancer, control cancer, ease cancer symptoms. First, cure cancer. When chemotherapy destroys cancer cells to the point that your doctor can no longer detect them in your body and they will not grow back. Control cancer. When chemotherapy keeps cancer from spreading, slows its growth, or destroys cancer cells that have spread to other parts of your body. Ease cancer symptoms. This method is called palliative care, when chemotherapy shrinks tumors that are causing pain or pressure. So Chemotherapy, other advantages, chemotherapy can make a tumor smaller before surgery or radiation therapy, and this is called neoadjuvant chemotherapy. Destroy cancer cells that may remain after surgery or radiation therapy, and this is called adjuvant chemotherapy. Basically, these are types of chemotherapy. Help radiation therapy and biological therapy work better, destroy cancer cells that have come back, recurrent cancer, or spread to other parts of your body, metastatic cancer. Next, side effects of chemotherapy. So, chemotherapy drugs have a range of side effects that depend on type of medications used. The most common medications mainly affect the fast dividing cells of the body, such as blood cells and cells lining the mouth, stomach, and intestines. Some common examples are myelosuppression and immunosuppression, gastrointestinal side effects, and cardiotoxicity. These are side effects of chemotherapy. So first, myelosuppression and immune suppression. Myelosuppression, it is a disease, basically a condition in which bone marrow activity is decreased, resulting in fever, red blood cells, white blood cells, and platelets. This disease is side effect of some cancer treatments. Okay, myelosuppression and immunosuppression depends on the type of chemotherapy and dose given, leads to anemia, thrombocytopenia, leukopenia, and neutropenia. Neutropenia increases the risk of infections, and the patient should be isolated and treated with broad spectrum antibiotics if an injection is suspected. Careful dental assessment should be carried out in patients who are expected to go into the severe myelosuppression. Post chemotherapy as bad oral hygiene is associated with increased risk of mental absence. Okay, next, gastrointestinal side effects. Chemotherapy induced nausea and vomiting, which can be acute or delayed. Nausea and vomiting occurrence depends on drugs used, as some drugs are considered more emetogenic than others. Mucositis, mouth ulcers, loss of appetite, diarrhea, and these are symptoms of gastrointestinal side effects. Okay, next, cardiotoxicity. Some chemotherapeutic drugs can lead to cardiomyopathy and heart failure. This depends on the cumulative dose of drug. In addition, previous or concomitant radiation to left hemithorax. Risk factors for cardiovascular disease and anemia may cause more cardiac toxicity. Some common examples of drugs with cardiac toxicity are adriamycin. Cardiac toxicity can be acute or chronic. Chronic toxicity can chemotherapy. Cardiotoxicity, it is a disease in which there is a damage to heart muscle. As a result of cardiotoxicity, your heart may not be able to pump blood throughout your body, and this may be due to chemotherapy drugs or other medications. So next, conclusion. Chemotherapy can treat cancer cells that are spread all over the body, but they have extremely toxic side effects. All of these treatments are still in use today and will probably be in use for a while, although they will not be only kind of treatments. Chemotherapy can be used to shrink a tumor so that other treatments such as the radiation and surgery are possible. So this is reference. Thank you so much everyone for your attention. Have a nice day. Allah Hafiz.